session. We'll speak with each of our panelists for a few minutes, and then we'll open it up to question and answer. You can send the questions via the question and answer feature or the chat. You can also tweet those questions to us at Shoe Bioethics is our Twitter handle. The first panelist we have today is President Joseph Nyer, who's the president of Seton Hall University. President Nyer, it's great to have you on the line. We have had a few conversations, and I know you've done some work and some thinking around the moment that we're currently in higher education, this liminal moment. So the opening question for you is, how are you thinking about the future of education? And just could you tell us a little bit about what sorts of things you anticipate in the years to come?
Sure, I'm happy to do so, and thank you for having me, Dr. Pilkington. As we've discussed at Seton Hall at length prior to COVID coming ashore, the higher education sector was in a liminal moment, was in a period of significant disruption and change. Traditionally, higher education goes through a major disruption or change about every 50 years, and it's been over 75 since our last major disruption. Now, higher education is often criticized for being slow to change, and our faculty and some of our students will not be surprised when I say this, but we're often criticized. And the old joke is it was easier to go back and change the course of history than it was to change a history course. Well, they no longer say that about higher education, because higher education, one, as a sector, is the nexus. It's the nexus of athletics and healthcare, education, policy, research, and for Catholic University, also faith. And prior to the pandemic coming ashore, our critics were appropriately saying that universities were saddled with far too much regulation, too much non-instructional expense, too much debt, that we lacked innovation and nimbleness, that there were too many colleges and universities, particularly in the Northeast and in the Midwest, and that change was drastically needed. About 5 years ago, Moody's and Standard & Poor's, the two predominant bond rating agencies, indicated that the higher education sector would see the failure rate of colleges and universities triple, all prior to the pandemic coming ashore. As the pandemic came ashore, you saw early responders, and colleges and universities on the Eastern Seaboard, particularly the Northeast, moved to ensure the safety of their college campuses. College and universities were early movers prior to any CDC guidance, prior to any state or federal government regulations or guidance. They moved to remote instruction temporarily and then full remote instruction to keep their campuses safe. As we went through that process, we saw change rapidly accelerate. So since the onset of the pandemic, we've seen, and it's the same in other sectors, that COVID serves as an accelerator for change that was underway, but also serves as like a bright light or a spotlight on cracks and fissures in sectors or in businesses or in universities, and also in our personal lives. This pandemic has highlighted the very challenges that may have been under the surface, have been exposed to the sun. And we're seeing great change and rapid change occur in our sector. We have many concerns about a post-pandemic higher education space. And I'll speak briefly about that in just a moment. I know we have limited time, but I do want to share that early in the pandemic, one common theme is there wasn't a significant amount of information available or guidance. And it wasn't for want of public officials that they were looking for answers too. At Seton Hall, we looked outside the country and across the country for early answers. So in late January and February, we were consulting with international health experts in other countries that have been hit earlier by the pandemic to better understand what was about to come to our shores and the types of policy changes that would likely occur. As we moved to remote instruction last spring and planned to reopen the university in the fall, not only did we need to take into account all the public guidance, but we needed to forecast where the sector was moving. And again, we recognized that change was underway in our sector. We've been very concerned about a number of elements. One is we think there are a number of institutions that are in fiscal peril. We think that over the holidays, we'll see additional layoffs and furloughs. We think we'll see a re-examination of higher education pricing and immense pricing pressure. We're very concerned about what the pandemic has done and will do to the economies of families and family savings rates, and what that means for access to college and universities. In the last 15 years, access has increased dramatically in universities. We're working hard to try to determine how to increase access to higher education across the country. But as the economic tail swings forward from the pandemic, we're very concerned about institutions that are failing. We're very concerned about frozen state appropriations and the difficult economic climate that is underway for states, counties, municipalities, and certainly families. We think that private and public institutions will continue to struggle, not just from frozen appropriations, but again, from price elasticity and other pressures. We think fundraising will be a more difficult enterprise moving forward, and it's a significant part of how we operate our sector in higher ed and how we garner resources to support student scholarships and student accessibility to higher education. So what that means for access, retention, persistence rates, very concerning. We also saw that early in the pandemic, and I'll say February, March, through the summer, rapidly changing degrees of acceptability of remote instruction and what that will look like in a post-pandemic environment. Early in the pandemic, universities moved very quickly to remote instruction. Seton Hall, for example, suspended classes for 3 days and worked with their faculty to make that conversion. And it wasn't the smoothest enterprise. And I suspect, and as we survey our students this fall, we also understand that it's not the most acceptable mechanism to receive a university education, but the acceptability has grown over the last several months across the country. And what that means in a post-pandemic space is very questionable. Will we see universities continue to offer remote instruction, and will that be a preferred modality for students who may not have considered it before? We think we'll see increased merger and acquisition activity in the higher education sector, particularly as universities struggle with enrollments. They've already been struggling prior to the pandemic. We've seen other changes in the sector. The Ivy Leagues went first, but across the country, we've seen a suspension of ACT and SAT test requirements for the next enrollment cycle because of poor access to ACT and SAT testing facilities during the pandemic. How we evaluate academic preparedness for students entering, what the disruption of the last year and a half will mean to students who were moving through the K-12 system, particularly high school, all open questions for us. We were engaged in strategic planning prior to the pandemic coming ashore. It accelerated our strategic planning effort, and our college university reopening plans were nested in our strategic framework. We know as we go forward, we have to take great care in the short term to protect one another in our campus. Currently, we have 12 cases for 12,000 people, a very low incident rate. We know we'll need to advance university affordability and access. We know, and we were already doing this, we'll need to continue to rebalance instructional and non-instructional expenses and identify and continue to make key investments in quality. At the end of the day, academic quality and the quality of the student experience are the two key ingredients to successful universities. There are many other elements, but that's at the core of what we do. As a Catholic university, we're striving to uphold our mission and ensure equitable access to Seton Hall. We, like the healthcare sector and other sectors, will continue to advance our financial recovery. The losses for the university last year and this year were not insignificant. And there certainly will feed into our next fundraising campaign that we expect to move into the silent phase here as the new year begins in January. So those are some of the elements about what was happening in our sector prior to the pandemic, how the pandemic has accelerated change, and what we see in the near to midterm when the pandemic clouds hopefully part very soon. So those are some of the key elements that I think about as I think about where we are in higher education and where we're going.
Thank you, President Nyer. That's very helpful, both to understand the perspective as leading Seton Hall, and also sort of where we might be going in that sector more generally. So thank you. We're now going to move from the education sector to the health and health business sector. And our next panelist is Mr. Robert Garrett, who is the Chief Executive Officer of Hackensack Meridian Health. Bob, thanks so much for being with us. We really appreciate it. So similar question to you as I posed to President Nyer. How are you thinking about the future of your sector? What should folks be thinking about? I think Bob, sorry to cut you off. I think we've got a small tech issue. If you could just click the unmute button, we should be good to go.
Am I off?
There you go. You're perfect now. Thank you.
Okay, great. Sorry about that. Yeah, thank you, Brian, for that introduction. Great to be with everybody today, and it's great to be part of a very distinguished panel. I just want to start by really thanking the leadership at the university for putting this series together. You know, I really believe that ethics training is so important in education, particularly today. You know, I want to, in the next 5 minutes or so, try to focus on some of the trends that are happening in healthcare over the next 5, 10, 15 years. And I would agree with President Nyer in healthcare, you know, as well as higher education. I think a lot of these trends were apparent. I think they've just been accelerated as a result of the COVID-19 pandemic. You know, as we make progress in delivering care, there's also many ethical issues that go along with that progress and some of those trends that I hope I will touch on as well. So ultimately, I think where the healthcare system is going is an ultimate shift from focus on healthcare to a health system, meaning a focus on wellness, a focus on disease and illness prevention, a focus on keeping communities healthier. So when I think about the short term, which is really the next 5 years, really a trend that really started over the past few years that will accelerate, I believe, is a focus on value and value-based healthcare. And what do I mean by that? I mean that simply that we want to achieve higher quality outcomes for our patients while making healthcare more affordable and providing better access to healthcare in doing so. That's really the value equation. And when you think about the next 5 years in healthcare, the whole health ecosystem, if you will, is shifting to rewarding these outcomes, these quality outcomes, and also rewarding hospitals and other providers, physicians and other providers on their outcomes and making healthcare more affordable. So we're doing this by really coordinating care, integrating care. A lot has been said about integration, about health systems forming integrated health networks so that care can be better integrated. These integration efforts are being aided significantly by new technologies that have emerged. And I'll just go through a couple quickly. Electronic health records, you know, probably no need to go into a lot of detail here, but that's helping to coordinate care. That's helping clinicians communicate more effectively. It's helping reduce medication errors. It's making healthcare more transparent so that patients and families can have access to their records, and their records can then be portable and transferable. Another specific area is really expanding access and making healthcare more convenient. So at Hackensack Meridian, as an example, we're not just 17 hospitals. We have 500 patient care locations, and they could vary from individual physicians' offices to surgery centers, to urgent care centers, to imaging centers, through the full continuum of care, right through long-term care facilities. And that's really a trend where health systems are really providing the full gamut of healthcare services. So I think that trend will continue to accelerate as more and more healthcare is being provided outside of the four walls of the hospital. I think you're also going to see as a major trend in healthcare, more uniform treatment, more treatment based on evidence-based practices. It's really the key to eliminate variability in treatment. There's a lot going on there. A lot was happening before the pandemic, and those efforts also have been accelerated where we're creating more uniform evidence-based care to improve outcomes. And just like in higher education, as Dr. Nyre mentioned, there's definitely more consolidation in healthcare, more mergers and acquisitions, not just amongst hospital systems, but amongst physicians and physician groups. And, the healthcare sector was hard hit by the pandemic financially. Many individual physician practices were particularly hard hit. I see many of those practices rolling up to larger organizations, whether they're private physician groups, multi-specialty groups, or hospitals or health systems, or even private equity firms that are getting more active in the healthcare space. Now, if we roll the clock forward to the next 10 years, I think we're going to see technology continue to advance. Talking about really where wearables that you see today that are really monitoring exercise and sleep patterns will start to get more sophisticated, and will be really monitoring your entire health and wellness profile, as well as your disease progression. There's no doubt care will migrate more and more toward the home. We even saw that during the pandemic with telemedicine and telehealth increasing, and people not going out, people getting locked down, if you will. More and more healthcare was delivered out of people's homes. I see that really proliferating over the next 10 years through the use of technology that really helps to link patients and families to their providers. You can actually imagine having a hospital at home, and I think that we'll see that more and more over the next 10 years. Another trend, I think, is a focus on population health strategies and the role that the social determinants of health play. No doubt there's disparities in outcomes. We saw that during the COVID crisis. Just one statistic out there, people of color were twice as likely to contract COVID-19 and 3 times as likely to die from this virus as well. So there's no doubt that we're going to need to really focus on these social determinants and to really change those disparities in health outcomes. So there'll be a focus on financial, food, housing insecurities, transportation challenges, mental health issues, a whole array of population health and social determinant focus. And then as we move 15 to 20 years out, I think artificial intelligence will really transform care in so many ways. It will speed drug development and clinical trials. We even saw that during COVID. You think about some of the therapeutics that got emergency use authorization so quickly, pharmaceutical companies speeding up their research and development efforts, and Operation Warp Speed at the federal level to develop a vaccine very, very quickly. So there's no doubt that artificial intelligence will play a role, not just in drug development and clinical trials, but will aid in diagnostics, particularly in areas like oncology and cardiovascular services. And I think you're going to see the next generation of radiology tools, imaging tools that can really transform how we're diagnosing patients. So, just as a, one quick example, we'll get to a point where monitoring devices will provide a detailed snapshot of health and wellness even while we sleep. We are even seeing in the area of behavioral health where new technology is evaluating elements of speech as you speak as key indicators of different behavioral and clinical conditions. So a lot going on. I think the next 10 to 20 years are going to really see revolutionary changes that have just been, if anything, sped up by the pandemic. And just quickly before I conclude, a few, just to tee it up, a few ethical implications from these changes, from these trends in healthcare. One is, integrated health records, the use of telehealth, telemedicine is going to create many privacy issues. I've already heard from patients out there that said when they were communicating with their physicians remotely during the pandemic, as an example, via telehealth, that in the background, they actually saw people walking, to and from the physician. So how much privacy is there when there's noise and there's people in the background? Artificial intelligence, again, will pose some ethical dilemmas in terms of who sees the information, where are the data sources coming from that are diagnosing patients. Rationing of care is another area. We saw that during COVID. Ventilators were in short supply. Vaccines may be in short supply when they first come out. Who's going to get the first doses? I think you're going to see much more in the way of ethical issues around rationing of care. And then in the area of population health and those social determinants that I spoke about, there's limited dollars out there. Will we have the moral imperative as a nation, as a state, as a healthcare system to really transfer limited resources, dollars from where they're going now to address the social determinants of health, to address the healthcare disparities? And then last, I would say the speed of delivery versus efficacy and safety as new drugs come to market, as vaccines come online. The COVID-19 vaccine poses that dilemma right now. Are people going to feel? Is there a moral or ethical issue with getting these vaccines to market so quickly, or getting these drugs to market so quickly? Are people going to feel that they're safe? So we have to balance speed versus efficacy and safety. So those are just a few of the trends that I see over the next few years, and some of the ethical issues that go along with them.
Excellent, Bob. Thank you so much. I think you could have set our agenda for the third season of the COVID ethics series with the number of issues you raised. So thank you. That's very helpful. And we saw a number of interesting themes coming up, both Mr. Garrett's comments and President Nyre's comments, and sort of thinking about the practices of education and health as they move into new spaces. So we're now going to turn to Professor Grantham, and we're going to ask and think a little bit about sport and sport in the future. So Professor Charles Grantham is the director of the Center for Sports Management at Seton Hall University. He's a former NBA player executive who oversaw a great expansion in that area. So Professor Grantham, very glad you're on the line. A similar question: how should we be thinking about sports in the future? In light of COVID-19, what kind of ethical issues arise? What are you and your colleagues thinking about now?
Well, first of all, thank you for having me on such a wonderful panel. Being educated very quickly here regarding health issues going forward. But on the sports landscape, prior to the interruption with the pandemic, we were looking at probably the most successful year from the standpoint of the NFL, on track to probably generate almost $25 billion by the year 2025. Basketball, baseball, hockey, all looking at prosperous years. In addition, the other landscape, which would be amateur or collegiate sports, I'm sure all were looking forward to very prosperous years. However, once the interruption of pandemic and hit very quickly in March, it was the NBA that was one of the first to cancel their season and to go into a deep planning mode to figure out how we can move this product forward, but at the same time keep our players and executives and their families safe. And I must admit that while sports is a microcosm of society and we operate in this fishbowl, when the problem came up, we also had to be one of the quickest to figure out a solution. Where's that pathway? We can actually keep our brand alive in the NFL and the NBA, and Major League Baseball, and hockey, and how do we do that and keep our biggest assets, which are the players and their families, safe? So the NBA, I must say, was very successful in creating a bubble environment, which allowed essentially to go through the completion of the season as well as the playoffs to crown a champion. So did hockey, without any positive test. So the challenge will be, certainly from a professional sports standpoint, is how do we re-engage the fans? And from an ethical standpoint, at what point do those athletes who are participating feel pressured into actually playing or opting out for a season? As we can see, very few opted out in any of the sports this year, and we are operating. At the same time, the demand on players is both physical and mental, because one of the things we all have certainly learned from you health experts is that we have no idea what the long-term implications of this virus are, and so many of the young people who may get affected vis-a-vis a heart condition or other organs being affected, we have no idea what will happen next year or the year after, if in fact those who test positive have actually experienced the virus. So going forward, the number one challenge for the professional sports leagues will be, how will they continue to meet the requirements of their television broadcast partners and their sponsors, and at the same time be able to provide a safe environment for fans to attend games. You know, it's very interesting. We sit in class often and we talk about the business of sport. And one of the questions that I continually raise with our students is, if in fact the playoffs were being conducted at Madison Square Garden next week, and I was able to get all of you floor seats, how many of you would actually attend? And to a person or to a student, they all said, no, we would not attend. So one of the biggest, I think a major going forward, is the challenge of sports as a business to better market their product to the point of safety, that we can actually engage fans of 16, 18,000 in the Garden, or 50, 60,000 at Giant Stadium. What does the future look like? And will we ever return in the next 2, 3, or 4 years to full-time capacity? A lot of that is a function of what happens with regard to the virus from the standpoint of a vaccine. Even if that vaccine is available, will our potential fans actually take the virus? I mean, take the vaccine? We've got so many issues that are unknown that it's affecting sports in a multiple ways, that the leagues and those owners who own the teams today, from a business perspective, look future-wise to think that, well, I'm going to probably own this team for the next 20 years. And so losses, as we look at the economic losses, which are expected to exceed $1.5 billion per team, per league rather, and how are players and owners going to absorb those losses? They anticipate those losses, but the big challenge for them is engagement of fans again. And I think on all of the commissioners' minds at this point is, when will we start our next season? Will the NBA start its traditional season in November, or will they push it back to Martin Luther King Day, which is some of the early indications? The later, the better, from the standpoint of being able to re-engage fans. And when will hockey start again? When will football start again? So, you know, when we look back and take a step at professional sports and how well it's prospered over all of these years, I've said in many occasions in class that the franchise values have increased at such a rapid rate. The revenue of all of the major sports have increased at an increasing rate, that if any of the professional sports could actually not play for one whole season, it's the professional sports leagues. Not a single one of them at this point has even suggested that some of these teams may go out of business. The wealth of the league, the foundations of the leagues are all very solid. As a matter of fact, as you probably have noted, Steve Cohen was a recent purchaser of the New York Mets, $2.4 billion. So professional sports seems to be moving in a direction of, let's wait and see. We're planning to engage or re-engage our fans, At the same time, we're continually looking for ways to keep our biggest assets, which are the players, safe. On the other landscape, however, on the college scene, the Power Five conferences in football, several ethical questions that would be raised there. But at that point, given the sources of revenue or the kind of revenue that's coming into these Power Five football programs, you could see that they have tried to narrowly figure out a way to get their seasons through. However, when I see 15 or 20 or 25 of these young people get the virus and not knowing what the long-term impact will be, I'm questioning the Big Ten when they first announced that they were not going to have a season until after New Year. It made perfect sense for me from an ethical standpoint. However, the culture of football being challenged the way it was, they took the pressure to realize that the funding and the revenue that was being generated from these sports were needed or necessary. And they folded, to quite frankly, under that pressure. But the ethical question still seems to me on the amateur level, on the college level, particularly in football, and the number of exposures and the kind of contact is as follows. The student may opt out, but who's protecting his interests or her interests at that point? They are going forward with the season. Some have been challenged from the standpoint of postponement and perhaps even cancellation. At the same time, the NCAA is being challenged on other ethical terms by Congress and state of California for names, images, and likeness. I think that's going to really put pressure on these various universities here going forward. But the ethical question, when we lost this young man, I think he was University of California in Pennsylvania, who died after contracting the virus, and a myocarditis, I believe I heard that term. And how is it going to affect some of these other young kids going forward? And asking them to come back and perform and play on a Saturday, at the same time teaching remotely, to me, questions the ethical decision of the Big Ten and Pac-12 at this point. So in closing, I think the future is uncertain, as in any industry, and is largely going to be a function of how well we're able to cure this disease and whether or not we're able to get a virus going forward.
Thank you, Professor Grantham. We see a number of themes arising, both in all of these sectors, right? Thinking about new ways that we move forward, thinking about how to protect different populations, whether it be students, players, fans, while continuing both business operations and also the sports and educational interactions that we love. So thank you. We're going to now turn to our final panelist, Professor Molly Patterson. Professor Patterson is the chair of political science at Aquinas College. And this is a very interesting time to be thinking about the future of politics and public policy, especially in the state of Michigan, which has been in the news a good deal recently. So Professor Patterson, thank you for joining us.
Thank you, Dr. Pilkington, for the invitation. And Michigan is indeed an interesting place to be thinking about the future of politics and policy. And I'm going to be a political theorist and think about them in sort of general terms, and perhaps in a slightly complicating way, hopefully. So in addition to COVID, part of what I was thinking about, 2020 has developed quite a reputation as a year. And so in addition to COVID, we've seen record-setting fires on the West Coast. I'm from the West Coast. The town where I lived in as a very small child is basically gone. California, Oregon, Washington, and Colorado have all seen larger fires this year than they have in their entire history. In the Midwest, the derecho storm wiped out power for thousands of people, especially in Iowa, and caused billions of dollars in losses to agriculture and small farms. And in the South, very active hurricane season once again, Wind and water did to communities and individuals in the South what fire did to communities and individuals on the West Coast. So we have seen an extraordinary amount of damage across the country, taking a variety of forms. And we're looking at additional damage as people in all of these places have been impacted with their ability to provide for their basic needs, to have food and shelter, safety, healthcare, and an income. And so we're also looking at, of course, the potential for a tremendous spike in homelessness as people who are unable to pay rent face the threat of eviction. So the issue that public policy needs to address is far bigger than COVID. And I think it has to do with vulnerability in general. Of course, part of what we've seen and some of what we know we need to address is kind of obvious, and people keep talking about the inequality. People who are disadvantaged under normal conditions, conditions of poverty and discrimination, are disproportionately affected and have the hardest time recovering when faced with these disasters. Had my parents lost their house, which mercifully they did not, they are well insured, they would be okay. But of course, the communities that were lost were frequently trailer parks, places where people don't have the resources to recover. And of course, we've seen the same thing with COVID. The people who are poorest or face the heaviest burdens of discrimination, that is also reflected in their healthcare outcomes. So clearly public policy needs to deal with inequality that's been so vividly on display in the pandemic. But I would also argue that we need to reframe how we think about some of these issues. And I think we need to reframe in particular how we think about vulnerability, and we need to move vulnerability from something that is we think of as a weakness or an aberration and reconceive of it as fundamental to the human condition, as something that we all face and we all deal with. And I'm going to take a tiny detour through a personal anecdote that's going to seem a little odd, but it really did influence my thinking about these questions after my initial conversation with Dr. Pilkington. So I was recently in a situation where I felt an obligation to plan. And what I needed to plan for was my personal safety. And I needed to plan for my personal safety because I had reason to believe that it was in jeopardy. I'm fine, just for the record. It's all good because I planned. But I will tell you that in the process of planning for my personal safety, I became aware of an extraordinary resistance to planning, that I felt actually an ethical obligation to not plan, because planning for my personal safety involved making certain assumptions about the situation, and imputing sort of motives to somebody else that I had reason to suspect, but I didn't have absolute evidence to confirm. And so that was the dilemma, that in the planning, I needed to make assumptions that things were possible that I was not supposed to assume about other people. And I think this is something that not everybody has experience with, but I think, women, and in many situations, say people of color dealing with law enforcement, that's the dilemma that you're faced with. But we also see this, when you scale it up to issues like national security and how we deal with individuals. So I recognize that dealing with COVID is entirely different in many ways from dealing with individuals. But what it really drew my attention to was the extent to which this ethical obligation to plan emerges in a larger context with other ethical obligations. And so I started thinking about what are the conflicting obligations that keep us from planning in the ways that should be obvious by now. The pandemic we could see coming. Maybe not in this moment, though we certainly had more warning than we responded to. But the disaster movies that people were watching on their couches at home were informed by previous pandemics and good science and research that tells me that we saw this coming. And you know, there's plenty of better evidence than the movies I was watching on my couch to verify this. But we have the capacity to know that inequality is a problem, that pandemics are a thing in the future. And so what is it in our current situation that keeps us from thinking better about vulnerability and the fact that we face it all the time? And I think, you know, this is a little bit obvious, but our emphasis on individualism, the idea that good people are self-supporting, that maybe they help their neighbors, but they don't need help from anybody, that they are able to take care of themselves. I mean, I think to assume our vulnerability and the fact that we need to create a social safety net that takes that into account is to fly in the face of our imperative to be good individuals. So I will, I think, leave it there.
Thank you very much, Molly. So you sort of helpfully highlighted both the sort of immediate practical concerns and then how the need to plan and the ethical duty to plan sort of extends beyond that. So we've had a bunch of questions coming in from the chat. Please feel free to send in more questions. And just a note for folks, because we will wrap up in about 15 minutes. Any questions that we don't get to, we can always follow up separately, and you can reach us both on Twitter and via our email at ethics@shu.edu. So I want to turn back to our two early presenters, President Nyer and Mr. Garrett, because they sort of helpfully pointed us to the different kinds of modalities in thinking in the future about healthcare and about education, respectively. Professor Grantham highlighted some safety concerns. So with that sort of safety gloss in mind and picking up a theme of a few of the questions, how, and I'll go to President Nyer first, how in education should folks think about delivering the highest quality in a different modality as opposed to sort of responding to the context? So we have excellent professors of all sorts, and they deliver material in different kinds of ways. They engage students in different kinds of ways. President Nyer, any recommendations for this question coming through in the chat about thinking about both quality and context?
Well, there's no doubt, it's been often said that necessity is the mother of invention. And our great faculty are clearly looking to develop additional forms of pedagogically sound practice. It's certainly going to change the nature of faculty development and the nature of university education. I'm struck, you know, I work closely with Bob Garrett. Bob serves on Seton Hall's board and I serve on Bob's board. And I had the pleasure of observing all the planning and the innovation that Hackensack was engaged in. And in many ways, it paralleled the work here at the university. And I was struck, Bob and I didn't coordinate comments. And I'm very impressed with our other panelists, our fellow panelists as well. But the investments in quality and the importance of quality, access, technology, and consolidation, those four elements I spoke to and Bob spoke to and are clearly significant drivers for the future of how we educate and engage our students. And Bob spoke about engagement with patients and the new reality that the doctor's office no longer has walls. And Professor Grantham spoke about it as well as it relates to a different type of engagement, but engagement of fans in professional sports. So as much as the pandemic is requiring us to change, it also requires us to go back to our roots: quality, access, technology, engagement. Those are elements that are central to higher education. As a psychologist, they're central to healthcare, right? It's just they take on new dimensions and new meanings and new realities. So I have no doubt we'll be writing about this pandemic for the next 50 years, but it's going to significantly change how we think about the classroom, the types of pedagogy we have, the types of technology that we deploy, and how we define quality. And that's an open question for us, but it's in a stage of rapid evolution.
Thank you, President Nyer. And that's the idea that we have these core ethical principles and we have to find new ways to work through them, but that they remain the same is both very helpful. And since I know a bunch of my students are on, very helpful since we just did ethics of telemedicine last week. So I want to switch now to Mr. Garrett. Bob, a similar kind of question. What sort of thoughts go through your mind in thinking about sort of the quality and the context, either in terms of telemedicine, and you spoke about a couple of ethical issues there, or just the future of health and health business? As President Nyer mentioned, Hackensack was known to be on the forefront of planning. We had Jeff Boskamp, Professor Jeff Boskamp, and Dean Bonnie Stanton on an early episode and talked about all the work that was done at the hospital in forward thinking. So how in the future should folks think about quality in light of the changing context?
Yeah, I think, what we're trying to do in light of the pandemic is really educate folks, because people are thinking about quality a little broader today. I think they always thought there was a safety element to quality in healthcare, but I think today what we're saying, the message we're trying to convey is that there is quality. Quality care is still being rendered, whether it's at the hospital, whether it's in an ambulatory setting, at your home through telemedicine, as I spoke about before. Safety is a very, very important part, I think, of people thinking about staying healthy. People don't just talk about health anymore; they talk about being safe, and it's just really, really important. So I do think education is going to be very, very key. And I think one of the things that people might ask is okay, well, even with telemedicine, how do we get that across, particularly to senior citizens who aren't used to that kind of technology, that might be afraid of it? I mean, we need to help them, and we did. As an example, during the pandemic, we had medical students helping our senior population with telehealth, telemedicine. We had care coordinators going out to people's homes because people didn't feel safe in returning to traditional healthcare settings. And telemedicine, telehealth, as an example, went from about 2 to 3% of our medical visits to over 60% during the pandemic. Now, for those that might be skeptical as to whether that's going to stay with us, you can look to the West Coast. Kaiser Health System has pre-pandemic have been running over 50% of their patient to provider interactions have been through telehealth or telemedicine. So I think safety is a very, very big piece. So as much as people thought about quality just from maybe clinical outcomes, I think people are going to want to think about safety. They want to think about alternative ways they can receive healthcare in a safe environment. And I think it's incumbent upon a health system like Hackensack Meridian to be out there to educate people that not only is our healthcare system safe, but you can also be safe and get good quality care at home through the appropriate technology and the appropriate connection with your provider.
Excellent. Thanks very much, Bob. That a very helpful answer. And we're now going to shift to Professor Grantham as we work back through. Charles, we've heard a bit about sort of fan safety. You mentioned player safety and their families. We have similar sorts of population concerns from President Nyer and Mr. Garrett relative to their own sectors. Are there, and I don't want to put you too much on the spot, but are there helpful comparisons? Because you mentioned a few different sports. The NBA went to the bubble. Other sports are maybe a little more open air and have other kinds of sort of options. Any recommendations for, or sort of the best ways to practically reason through comparisons between one sport and another sport. So are there lessons that we can learn from thinking about the different kinds of ways that folks engage in sport?
Yeah, I mean, if you take a look at the bubble that was created by the NBA, a lot of planning and the implementation required both a partnership between those who play and those who own teams. And it was that kind of partnership that enabled this thing to work properly. But that meant that all players had to have the discipline to stay away from their families and play in a bubble for 4 months. It netted 0 positive tests. So from there, we can go and say, okay, how can we get close to creating a similar bubble? In football, they're failing slightly because they don't have a local bubble. Hockey went to 2 bubbles. Maybe in pro sports, it may mean 5 bubbles, but the bubbles would essentially isolate the players and their families or players for some period of time and play within the context of 2 or 3 cities as opposed to traveling to 18 cities. It could very well be that if you look at the March Madness that may be coming up in basketball, that month of March, the bubbles that were essentially created in different locales that were playing regional tournaments, they may take on a different look this time. I can only keep going back to hockey and basketball because a lot of planning went into the execution of that bubble. They paid handsomely, probably 160 to 180 million bucks to make it happen. But if you step back and look at other sports and you think about the concept of the bubble and how effective it has been to manage the spread, then as close as you can come to that bubble, the better off and safer I think you'll be going forward.
Excellent, thank you. I appreciate that, Professor Grantham. And I'm going to use a sports analogy to transition to a question for Professor Patterson. So as you mentioned, the NBA has been super successful with the bubble. Actually, from what I had read, the first team sport to actually start post-COVID or during COVID was the National Women's Soccer League, which I think was also very successful. But, and this, Molly, raises the question for you. What happened, if I'm remembering correctly, with the NWSL was one team ended up not being able to play, or a few players weren't able to play because they are involved, as we all are, in broader communities. And to Professor Grantham's point about discipline, not everyone outside of the teams and the broader communities acted in the most, let's say, disciplined way. So in a world where folks are of very different minds about a variety of subject matters, we actively have ethics conversations about, and even public campaigns in favor of wearing masks, just as one example. Molly, how do we think through, how do we live with moral disagreement, given that we're so dependent on ourselves and on all sorts of other folks, all of whom are vulnerable?
I wish I knew. That is something that I have been thinking about a lot, that we tend to be looking to systems to solve political problems. We redesign the political system when we feel like it's not functional, and we think about, well, if we had more of a parliamentary system or ranked choice voting or all of these different ways we could organize the system, would it produce better outcomes? And I think one of the things that the pandemic has illustrated is the extent to which systems only go so far to compensate for individuals, that the people and how they think and how they behave and how they interact with each other and how they treat each other during an election, if that it doesn't matter how you organize the separation of powers, if people do not value each other and view each other through sort of a lens of goodwill and some sort of honorable approach to disagreement, no system design in the world is going to save us from ourselves and each other. And so, I do think it really highlights the importance of how we treat and build our culture such that people can reason and debate and invest in the future of the democracy. Students seem to think that if democracy went away, they would just not have to vote and life would stay the same. And so, we need to find ways to get people to take seriously the fragility of the system we're maintaining and work to make it more cohesive.
Thank you, Molly. That's very helpful. And we're running out of our time a little bit. I'm going to turn to each panelist for a final final one-line comment. And Molly, you helpfully brought us back to the students. So I'll start with President Nyer, and then move back through each of our panelists. A word for our students and our colleagues on the phone or video from your own sector. What's one line that they should take away as they look forward to the future?
That our university system is doing everything it can to try to ensure a quality education in person, in a hybrid format, a high flex format, or remotely. And I'm grateful that by and large, our students and our families have been both patient and supportive in recognizing we're all in this together. And it's only together that we'll get through this.
Thank you, President Nyer. Mr. Garrett, a final line on health.
Yeah, I think what I would leave the students with is simply that the trends in healthcare that are being accelerated because of the pandemic are actually a good thing in a lot of ways. It's if it means doubling down and addressing some of the social determinants of health, focusing in on value, providing better access, better affordability, better quality outcomes through enhanced use of technology. All of those things that I mentioned that are being accelerated because of this pandemic, I actually think the future is bright, and I would leave the students on a very optimistic note. We're going to go through a tough period, but at the other side of it, the other end, I think you're going to see a much more improved healthcare system.
Excellent. Thank you, Bob. Charles, a final line on sport.
I guess the final line to me would simply be practice self-discipline during this time of uncertainty.
Wonderful. Thank you. And Molly, wrap us up with one final line for the students. I think I might have lost Molly there. Okay, well, we will then move forward. So thank you everyone for joining us. A special thanks to all our panelists. It's an exceedingly busy time in health and education and sport and public policy. So I'm very, very grateful that they all joined us. And in addition to the themes we've discussed, I think we have a meta theme of the importance of collaboration, which President Nyer and Mr. Garrett both highlighted. So next week, we're actually going to discuss the relationship between health and politics. So please join us on October 29th at 4 o'clock for that conversation, which will feature, again, a multidisciplinary panel. Also for folks at Seton Hall or anyone who has questions about voting and preference as we lead up to that panel, you can get more information here. Please check out the COVID Ethics Series podcast. We just went live with a podcast, which is very exciting. And as always, any questions, comments, further up conversations, please reach out to us via social media, on our email. And my sincere thanks again to all our panelists, to Angelia Oxford, who coordinated this session, to Kelly Freeman and her office and Student Services for collaborating with us, and for the IHS Library and Allison Piazza. So thanks everyone, and have a good day.